Back in the day, we used to say 3 miscarriages. So they used to be quite serious about saying they need to be consecutive. We now acknowledge that after 2 pregnancy losses, even if they are not consecutive, you warrant investigation. So you are not being dramatic. You are not, being a difficult patient seeking healthcare if you have gone through 2 pregnancy losses. Why do we say 2? Because 1 pregnancy loss is incredibly common. A lot of women are going to have pregnancy loss. They're going to go through a miscarriage, like I said, 1 in 4. But it's when it happens a second time that we start looking at, can we find something to try and change that outcome for you? When you have been diagnosed with a miscarriage, whether it was a pregnancy that you have worked your heart and soul and your financial ability into, whether it's IVF, your first IVF, your 10th IVF, or it's a month after having stopped the pill, it is devastating. And the most devastating thing about a pregnancy loss is, how do you grieve the loss of somebody that you never met? And I want you to sit with that for a second, because if you have not experienced a miscarriage, that is exactly what it is. And I can stand here in front of you not only as a doctor speaking to a group of patients, but as someone who has experienced a pregnancy loss. It is one of the most lonely and isolating things that you can possibly experience. Because we all decide, don't tell anybody that you're pregnant until you pass the 12-week mark. So what ends up happening is you and your partner, maybe one person close to you, who knows that you are pregnant, then you have to go through either not telling anyone that you've had a miscarriage and not having that support in your group of friends and your family around you, or having to go through the trauma of saying, I was pregnant and now I am not, which is a lot harder to do. So it is incredibly lonely and incredibly isolating, and it comes with a lot of other emotions. There's a lot of guilt, because as women, what do we do so well? We blame ourselves. It was that cup of coffee I had. It was that glass of wine when I didn't know I was pregnant. It's because I didn't do XYZ for 6 months before I got pregnant, or I picked up this thing. That's what caused the pregnancy loss. That's what we do. And even as a health professional, I could not sit there and clear those thoughts from my mind, because even with all of the knowledge that I had, you still have moments of doubt. So there's a lot of guilt that comes with it, and I can assure you that short of actively taking medication to end a pregnancy, there is nothing that you did or could have done to compromise a pregnancy. Okay, that is the most important message that anyone who has had a pregnancy loss needs to know. It was not you. You could not have prevented it. You could not have done something else to change it, and going forward, there is an option of what we can do to try and help you. Okay. One of the other feelings that we often feel is shame. Like, am I that person? There's a lot of shame around infertility, and I really wish that there wasn't. But there is a stigma, and there is a lot of shame. And when you start having miscarriages, you start feeling like, okay, maybe I've come from an infertility background, maybe I haven't. But is there something wrong with me that I can't carry this pregnancy? And we all have those terms in our head. A hostile womb. Do I have a hostile? Am I barren? Like all of these really negative and loaded words. So there are a lot of feelings that we need to unpack when we're dealing with pregnancy loss. And then the minute we say recurrent pregnancy loss, you're going through this more than once. The really difficult thing as well is, let's say you've had 1 pregnancy loss, you're suddenly pregnant. The amount of fear that you have going into that pregnancy, because everything was fine the last time until it wasn't. And now, do I feel nauseous? Are my boobs sore? Am I crampy? I'm not crampy today. What's going on? Something different. And you start to panic a lot of the time. And that panic ruins and steals all of the joy out of that pregnancy for you. So what we need to do is identify how we're going to support you through the loss, how are we going to support you in another pregnancy, and how are we going to prevent this from happening again. From a medical side, there are an array of tests that we do. Now, the problem with recurrent pregnancy loss is that you need to treat it as the symptom. Losing that baby was your symptom. We need to understand why this is happening. I know everyone who's gone through this wants me to find that one thing so I can say, that's what it is, that's how I'm fixing it. But that's not always the case. A lot of the time we do a lot of blood tests, which are very expensive, that there's a lot of conflicting literature about. We might be checking your own genetic profile. We might be checking if you have clotting disorders, if you have antiphospholipid syndrome, that everyone knows the term lupus, and then we start looking for the lupus anticoagulant. It's not looking for lupus. We are looking for something that is associated with pregnancy loss. So there are a whole array of blood tests that we might be doing, and you don't want to find one of those things. So when your doctor turns around and says to you, it is not one of those things, you should say, hallelujah, it's not, because you don't want that long-term condition. The other tests that we're going to do, we're going to be looking at what's happening inside of your uterus. I always like to think about it as the baby being a tenant who's moved into the apartment. We're going to make sure that that apartment is fully renovated and ready for a pregnancy. So are we missing something? Is there something you were born with inside the uterus, or has multiple pregnancy losses left scar tissue inside of the uterus? Is there a situation where the uterus is inflamed and we need to treat that? Are we missing small polyps for small fibroids? So we are going to look at that medical, sort of physical side as well. Once you've gone through all of that, the thing you're going to want to know is, what are my chances of having a baby at the end of all of this? And that's where we need to individualize your situation. Because we can look at all the data, and we can look at all the tools. There are new tools that have come out that help us predict what your chances of taking home a baby. But that's the thing that's going to give you hope. You want to know what your odds are, and you want to know how you can improve them. So in terms of looking at your chance of taking home a baby, we have to look into account your age, how many pregnancies you have lost before, because someone who has had 2 pregnancy losses is very different from someone who has had 6 pregnancy losses, and that does happen. And that's not to undervalue someone who has had 2, it's that you are different patients. And that's what we are there to do as the health professionals, find something that we could perhaps try and improve for you, find something if it is diagnosable, optimize you for the very next pregnancy, and then provide the support that you need in that pregnancy. Understanding where you are coming from, this background of a lot of fear and anxiety. And again, that's where I challenge that concept of not telling people that you are pregnant until you're past that 12, 13 week mark. Because you want to have your community who understands you. You want to have a group of friends who know what you are going through, who are not going to invite you to the 5th kid's birthday party and then get upset that you haven't come. They're not going to, say, what's wrong with you? Why don't you want to come out with us? Why are you so on edge lately? You want to have that group of men and women who can support you. You want to know that your husband, male partner, female partner, or whoever else is doing this journey with you also has support. Because what tends to happen is the person who's lost the pregnancy gets all of the attention and all the support, and the person next to them is just trying to hold them together. But they are grieving just as much, and they also need that support. So I know both sides of that story can be very triggering, but just know that you do have access to healthcare that can walk you through that journey with our entire multidisciplinary team, and it doesn't need to be lonely, it doesn't need to be as intimidating. And that's that.
So who am I?